Right. Good morning, everyone. Good morning. Welcome to the Health Data Science Focus Research Program Workshop. That's me. It's a picture of me with slightly less hair. I'm Stephen Brown. I'm the Executive Director of the Hariri Institute for Computing at BU on the Charles River campus. I'm not a researcher. I'm an administrator. My primary responsibilities include oversight of the facilities, communications, personnel, and financials of the Institute. Normally, this presentation is given by my supervisor, Yanis Pashalides, our faculty director. We need to step away due to a family medical emergency. So why are we here? Hopefully to learn more about our internal funding opportunities, meet potential collaborators, and connect with project leaders from past awarded projects. Also to network outside of our silos, which I know is difficult here at BU. This event is organized and supported by 4 groups: the Digital Health Initiative at the Hariri Institute, the Evans Center for Interdisciplinary Biomedical Research, the New Center for Health Data Science, and the BU Clinical and Translational Science Institute. Today's agenda: after my remarks, there'll be presentations from a few of our featured Hariri stakeholders. I'll introduce them individually later, followed by 4 lightning talks from our faculty as well, a brief brainstorming session, and a Q&A. And then finally, lunch. We're on a bit of a tight schedule today. So for the faculty lightning sessions, the presenter will have 4 minutes for their presentations, followed by a Q&A afterwards. Please hold your questions until the end. As a reminder, this event will be recorded and uploaded later to the Hariri Institute YouTube channel. So if you miss something, you can always watch it later. So as I mentioned, I won't do individual introductions for our faculty lightning presenters later, but these are them. I think they're all here in the audience. We'll have Kayhan Associate Professor of Electrical and Computing Engineering, and one of our current Hariri FRP leaders. Nahid Badilia, the Associate Professor of Infectious Disease and the Founding Director of the Center for Emerging Infectious Diseases. Swathi is over there. The Ying Professor of Neurorehabilitation, Founding Director of the Center for Brain Recovery, and also a former FRP leader for the Hariri Institute. Irena Vodenska, Professor of Finance and Director of the Finance Programs at BU Metropolitan College, and Greg Wellenius, Professor of Environmental Health, Director of the Climate and Center for Climate and Health at SPH, and a former Hariri FRP leader as well. So what is the Hariri Institute? The Hariri Institute is an interdisciplinary research incubator centering around AI, data science, and computing with over 400 faculty collaborators. We have 10 research units within the Institute, focusing on everything from applied AI to cybersecurity, distributed computing, gender and racial wage gap analysis, and application development. A little bit about our focus research programs. This is the nuts and bolts and summary of our funding programs. You'll see this slide a few times today. One of our other major activities in the Hariri Institute is seed funding in the computer science space. This year's focus is health data science. Our main seed funding program, called the Focus Research Program, seeds 2 to 3 project proposals annually up to $100,000 with the help of our internal partners. We look to fund medium to large teams with 1 to 2 senior PIs, 2 to 3 thrust areas within each FRP. Each FRP has a runway of a year with the goal of seeding new collaborations that will lead to even larger sponsored research opportunities and increased feedback in interdisciplinary areas. Specifically, we're looking for teams that need prior proof of concept or more seasoning before they go after larger proposals. Throughout the program and after the program as well, the Hariri Core Administrative Team can assist FRP leaders with organizing meetings and a symposium, grant submissions, and other communications needed to get your research out into the world. Part of the goal is to be nationally known for the team, as a team for the project that you're working on, and possibly put your research in front of external collaborators, or reviewers from an agency. The deadline for this year's pre-proposals is Valentine's Day and February 14th, and for full proposals, it's March 25th. A little bit about some of the projects that we funded this year. We have AI for earthquakes, specifically early warning systems and video surveillance, energy analytics for data centers, focusing on cost reduction and privacy preserving optimization frameworks. Research on self-driving autonomous labs, exploring the biases of AI and breast cancer risk predictions, which one of our speakers will talk about today, and machine learning to improve the diagnoses of cognitive impairments, specifically with Alzheimer's disease. These are our socials. This will be up later during lunch. And now, for our first presenter, this would be William Tomlinson, Director of the Software and Application Innovation Lab here at the Hariri Institute.
Good morning, afternoon-ish, everyone. Happy to see a lot of our collaborators here in the room today. Again, Stephen, thank you for that brief introduction. For those who have not met me before, I'm Will Tomlinson, the Director of SAIL, which stands for the Software and Application Innovation Lab here at BU. We do also sit in the Charles River campus in the CDS building. And SAIL essentially is a professionally staffed software engineering group. And our task is to develop full-stack web and mobile applications that support the applications of and research of those such as yourselves. Mainly, we focus on providing the production quality component of the software when the things you all have in your research spheres need to exist and live and breathe outside of just the folks in your lab and extend to larger audiences. So just a quick background on some of our services. So we have several projects that run concurrently throughout the year. We break our projects up into these following program areas, as we call. So from EdTech, data science, AI has been a growing topic, as you all can imagine, privacy and security, more so in the applied cryptography domain, digital health. So a lot of our mobile applications we develop are in the digital health domain, and then natural sciences. And we offer other services as well outside of full stack software development. And they're listed here: project management guidance, staff augmentation. We work a lot with IS&T and Marcom even. And even at an entry level, we can collaborate in terms of software best practice consulting for some of the work that you all are doing within your labs. The biggest thing I like to advertise sort of hesitantly is the proposal and grant writing piece that's largely baked into my position as SAIL director. So that's a no-cost service to you all as faculty, but in the pursuit of extramural funding and grants that might have a software engineering component, and I have PI status at the university as well, so we can co-collaborate to help pursue those opportunities that you all might be seeking. And a few of the example technologies we built with software, microservices, those are things we typically do for internally based resources that we have within our own place within BU. Multimodal data repositories, a lot of those have been for education use cases, whereas diverse data sets on student intervention and assessments, hardware, software for machine automation. But I think the most important ones to highlight are outlined in the red dash boxes here, and those are the ones we typically have done for a lot of the folks in the room today. So mobile apps for digital health, computation-based web applications. So for example, like a deep learning algorithm that may be deployed in a backend somewhere where we interact with that via front-end user interface that's exposed to a larger audience. And most recently, AI and machine learning-based applications, which I'll talk more about in the next slide. And there's been a few folks in the room who have utilized SAIL for data visualization work as well. So just to give you sort of a breadth of overview of the type of things we develop, and each of these span into their own different research areas and domain expertise areas as well. It's not just limited to a particular field. So most recently, I think this is the most important piece to touch on, seeing is that a lot of attraction, not just at BU, but even in your own research is leaning towards the AI domain. So I think we're one of the few groups on campus, BU as a whole, that can develop end-to-end solutions with AI with respect to web applications or mobile applications. So by that, I mean from looking at specific frameworks or tools to just developing applications that may be powered by AI or just deploying an ML model and serving it in the cloud. And even most recently, a lot of work we've done with respect to large language models have been in the retrieval augmented generation space or RAG space. And even more recently than that is that we're even collaborating with Big BU as a whole to help shore up how they pursue enterprise level large language model deployment for the entire university. And so we've really been knee deep into a lot of, I think every person at SAIL now is involved in some project that has AI or another. And so that's one element if you're looking to discuss or collaborate with, we're happy to talk and have a discussion about what we can bring to your research and help drive some of the progress you've been looking for. That's it for me. Thank you.
All right, thank you, Will. Our next speaker is Katya Ravid, founding director of the Evans Center for Interdisciplinary Biomedical Research.
Okay, so good afternoon, everyone. I'm Katya Ravid. I was advised to reintroduce myself. I'm a professor of medicine, biochemistry, and biology. And I'm the founding director of the Evans Center for Interdisciplinary Biomedical Research, the mission of which has been to really promote interdisciplinary research. We have been doing so for over a decade. Our logo is linking research and researchers. And one of our major building blocks are the Affinity Research Collaboratives, or ARCs. Those are groups of investigators that represent different disciplines and that undergo through a period of pre-ARC where they are advised through mechanisms that we have in place involving faculty as to how to further develop their own project. And we provide funding for up to 3 years. I mention it because past awardees of this RFP mechanism could be considering to move on into an ARC application, provided that, again, they are interdisciplinary, and such support will be available, as I said, for up to 3 years. In addition, I want to mention that there would be support for data science as we have developed this collaboration, particularly in recent years with the leadership of Yanis, which we are really very appreciative of. And want to make you aware of other resources other than the funding that will come through this current mechanism. There will be pilot awards that will be co-sponsored through the Department of Medicine, the Hariri Institute, the Dean's Office, I believe. And I just am highlighting just an example of other resources that you want to be aware of, such as the American Heart Association strategic RFP on novel AI approaches to study cardiovascular disease and brain health. And there are many such other initiatives that we can bring it to your attention. So enjoy the talks and take advantage of all those opportunities that really the basis of which is interdisciplinarity. I want to end by thanking Yanis and thanking the organizer, Catherine, and Robin, and the communication office, and whoever I have not mentioned.
Alrighty. Thank you, Katya. Our next speaker is Laura White, professor of biostatistics and associate director of the Center for Health Data Science.
Thanks, Stephen. Grateful to be here today, an opportunity to talk about the newly launched Center for Health Data Science. I'm an associate director of the center, and Debbie Cheng is the director of the center. She's away this week, and I'm doing my best to represent. So I want to just give you a little background on what our newly launched center is. This has really brought together two entities that have existed on the medical campus. First is BDAC, Biostatistics and Epidemiology Data Analysis Center, which has been here for decades, a very mature center that provides a lot of services to support biomedical research, sort of from conception to longevity of a project over the whole lifespan of a project. With our population health data science program, which Debbie and I launched about 2 years ago, meant to really foster data science research, bring together researchers across both the medical and CRC campuses. So we're really excited that these have come together, allowing us both to help bring researchers together, generate a lot of research, and also provide the services that BDAC has been offering so well for many years. So we have, as our center, really a vision of providing data science for the health of all, really in line with the mission of the School of Public Health. You can see a lot of our areas that we're working on, first fostering a lot of collaborations across multiple disciplines engaged in data science, really respecting those who generate data, as well as those who are have a lot of skills in analysis and storage and maintenance of data. We seek to provide training and continuing education opportunities in health data sciences. We're working to catalyze and support development of novel data science research. So efforts like today are very in line with that. Also providing a comprehensive range of high quality data science services, and I'll talk a little bit about that. And then also really seeking to promote data equity to advance health equity, a really area we're very excited about and feel very passionately about. This is a bit of our leadership. As I mentioned, Debbie Ching's our executive director. Kevin Lane and I are serving as associate directors. Joe Palmisano and Emily Sisson, who are here, are leading out at BDAC and have been in that role for a while. And then Carly Britton is serving as our director of business development and strategic growth. She comes to us from BMC, so many of you probably know her quite well. Our goal of the center is really to create a vital resource that integrates high quality data science into the core elements of the School of Public Health's purpose, which is to think, teach, and do, ultimately generating knowledge for the health of all. So that's a bit of what we're aiming for. With that, I want to mention a bit of the services that we do offer through BDAC, and you can talk to Joe and Emily. They will give you much more detailed and expert information on this. But to mention, BDAC has quite a breadth and depth of services offered, both in technical expertise, which you can see a lot of information on data resources and expertise with many different types of data sources, as well as expertise in a lot of different content areas. So a staff of around 30 folks who have been working in a wide range of areas, from data management, project management, analytics, and so on. We're really excited to also announce that we've been building out services at BDAC to include BDAC GIS services, and this is an effort Kevin Lane is leading. So many of you might know Kevin and the work he does in GIS. So this is being brought in-house with BDAC, and we hope it's just the beginning of building out enhanced services that BDAC can offer to really meet the demands of the growing types of data and analytic needs that we have in the data science world. So our goal is to create BDAC, to have BDAC be really a one-stop shopping of sorts for all your data service needs in the health data science research areas. So I will stop there. Thank you.
Thank you, Laura. Our next speaker is Bill Adams, Professor of Pediatrics and Director of the CTSI Biomedical Information Program.
Perfect. Thank you so much. I'm going to just quickly fly through some things that you may know about and a lot of things you probably don't know about to let you know about what you could start doing this afternoon if you are really interested in using clinical data for your research activities. In the BU-CTSI, I lead up mostly the clinical research informatics core, and a lot of our work is around getting data from clinical settings into research settings in a way that's safe and protects patient privacy, but makes rich data accessible. And without going into too much detail, we have access to most of the clinical data in the clinical data warehouse at BMC. We have consultations available for folks who want to use clinical data in their research. We also remind everyone that there is a clinical data warehouse for research at BMC, also available for doing really deep consultations and accessing raw data. We have a variety of self-service tools on the left, and I'm going to show you a couple of them very, very quickly in 5 minutes. And then we wrangle the BMC data into a common data model so that we can share that data and collaborate with folks all across the country and all across the world. And those are those networks on the right. And the idea is through this shared work, we can create local and national research networks. And we don't have time to go into everything, but each one of these slides has a URL, and I would encourage you to go learn from these communities this afternoon, even if you're interested and excited. The first one is the common data model that we use is the OMOP common data model, and the Odyssey research community is a super rich open source community where you can learn on your own about how to use the data model that we have in place. And on the right is a quick picture of the OMOP common data model, and you can begin to see how the data are represented. We also work closely with a commercial company called Trinetics, where we upload our OMOP common data model and all of a sudden have access to both de-identified exploration of our own data, but also the ability to pool our data with over 90 other health systems and generate data sets in the 200 million person range. We also, through Trinetics, have some really rich cloud-based computing environments called Lucid, which people can use, and we're starting to use from the Charles River campus. And we can also download that data for use here at BMC too. We have at least 8 projects that are starting to do that. We're also engaged in the ENACT network, which is a national network of CTSI-based systems, where you can write a query here at BMC and send it out to over 45 other institutions all across the country to identify potential cohorts, bring that data back, and then begin to form collaboration. So all these tools and resources are available to you guys if you're interested. We also just recently joined the PATH network, which is a patient-empowered network. It's supported by PCORI. So all the research that happens within this network needs to engage patients directly. We also have a whole bunch of other institutions that are eager to partner on patient-centered research that uses clinical data and, in many cases, direct patient contact to advance research as well. And finally, we've recently created a tool ourselves here on at BMC called the Health Equity Explorer, which is an open source tool based on R-Shiny. We've built the starting prototype of the system, but we would love to work with people to add new modules. What the system does is brings together pre-computed health outcomes with a whole bunch of attributes and links all the clinical data about a person to the places that they live. And last but not least, we're also active in the All of Us network, which has rich omics data, as well as clinical data, as well as patient reported data. And we also have been active in the N3C, the National COVID Cohort Collaboration. So I often say we have more data than scientists, so it's really up to you guys to come work with us and learn from us, and we are eager to help you succeed in your data work.
Great, thanks, Bill. As I mentioned, I'm not going to do introductions for the faculty lightning presentations, but I know the first one is Irena.
Thank you so much, and thank you for the invitation to be here. So I wanted to thank the organizers and the leadership of the Hariri Center, not just for organizing this workshop, but also for funding the research that I'm going to present. This is one of the research projects that we did collaboratively on climate change disinformation, and the socioeconomic effects are a future work of the research. So I'm going to present mostly on what we identified in our research of what is going on social media as far as climate change disinformation goes. We looked into posts on Twitter. We looked into information on Reddit. We looked into native advertising, meaning how corporations get their way into the mainstream papers and promote themselves, which is not journalism. And we also looked into how disinformation affects the general public and shapes public opinion with the consequences, of course. The team that was involved in this focused research project includes Chris Wells, Sarah Finney-Robinson, Michelle Amazin, Ronima Krishna from the College of Communications, Hyunwook Kim and myself from Metropolitan College, and we have Gianluca Stringini from the College of Engineering. So I'm going to talk about the questions that we were asking and some of the answers that we obtained through the research. So the main question was how to tackle climate disinformation, how to defend the integrity of climate science and scientists, how to respond to challenges in climate policy and corporate disclosure, how to understand the message, sometimes very convoluted, in social media, and then how to finally engage policymakers and the law in tackling the issue and also reducing the adverse effects on the public. We looked into extracting keywords from climate-based websites and cross-referenced with the tweeters that were coming from 50 ExxonMobil funded organizations and analyzed 22,940 tweets from these organizations, which we clustered. We vectorized them, used the T5 text-to-text transfer transformer, and in the clusters, we created similar clusters of similar tweets that were surrounded with the topic. The clusters that I wanted to point out that surfaced with a large number of tweets where climate change is not threatening. There were lots of tweets in this cluster. And another Biden energy plan hurts economic growth. We sifted through a lot of these organizations' narratives and then expanded the research. We leveraged the contrarian claims to search further. We identified 1.4 million tweets between 2007 and 2022 surrounding the 5 super claims that were explained in Kayhan et al. Paper in 2021. Namely, the 5 super claims were global warming is not happening, human greenhouse gases are not causing global warming, climate impact are not bad, climate solutions won't work, and climate movement and science is unreliable. We looked into dynamically showing the narratives from 2007 and which dominated in 2022. The dominant narratives were around climate impacts are not bad, and as you can see, very highly ranked here, no health impacts. So identifying all this in the future, expanding this environmental aspect of research into the ESG arena, or sustainability and responsibility of corporations, because as governments can do so much, the corporations need to step in with their sustainability and responsibility, namely mapping the sustainable development goals into the ESG, and the number 3 goal, the good health and well-being for all, falling right under the social arena. Thank you very much.
Next, we have Swathi.
Okay, good afternoon. And again, thank you to Yanis, Catherine, Stephen, and Hariri for this invitation. I'm going to switch topics and move to the brain. We received a focused research program award to look at different aspects of brain health. And we had 3 thrusts as part of this. We called it the continuous brain monitoring. There were a bunch of faculty on both campuses involved in this research thrust. The second one we call brain fingerprinting, which is trying to look at different aspects of the brain, which I'll explain these in a bit. Again, a combination of scientists, engineers, and clinicians involved in this effort. And our third thrust was called digital health, which is another big topic that we're all interested in these days on both sides of the campus. So in terms of our first effort, which was continuous brain monitoring, we're interested in developing, we're already working on a collaboration looking at new hardware that combines brain imaging with multimodal data collection. But as part of that focused research, we decided to first get together on a project we were collecting data on, where we have a bunch of folks studying high definition functional near infrared spectroscopy. Miriam Yusil, who's here, is involved in that work. And it's a bunch of people looking at FNIRS as a method to brain function across different populations, stroke and autism and so forth. But my group is focused on stroke and dementia. So in this case, we are trying to include auditory recordings and eye tracking. And that's just an example of 2 students collecting data as they're walking on BU campus. And one of them is wearing the brain cap and they're talking about movies. The goal for this thrust was to develop an idea and collect some pilot data and methodology so we could eventually end up with a grant submission, which we did. It didn't end up getting funded, but the goal was to then take this high definition FNIRS device. This looks like a future version of that, where it's easy to wear, it's completely wireless, and it's also collecting data on speech, movement, audio recordings, eye tracking, with the ultimate goal. And this research grant was about to look at people with aging and dementia and stroke at their homes. So the idea is to deploy this device in people's homes, research participants' homes, as they're going about their daily life, like walking and talking, and see what's going on with the brain. So that was sort of the first research thrust. And the second, again, there are a lot of people on both sides of the campus looking at brain imaging and trying to look at brain image phenotypes and using machine learning in this process. So the first thing we did was organize a machine learning tutorial on the medical campus, and students who are all doing work on this topic presented their different approaches of machine learning and brain prediction, or sort of what we're calling brain fingerprinting. And then there's a couple of ongoing research projects that ended up making it to either a submission or a grant proposal. I'll just give you two examples of that, and both were student-led. This student actually was a CDS, Computing and Data Science student, who worked with computer science faculty and CDS faculty, including Margaret Betke, and Archana Venkatraman and others. And here it's very complicated. I don't have to get into the details, but the idea is that you can take multimodal brain information and behavior information and develop, in this case, support vector models and random forest models to predict post-stroke aphasia severity. This is an area of my research, but we're trying to look at data in terms of how well it predicts brain function. Here's another example. This is one of Archana's students building a graph convolution neural network model, which is a far more efficient way to look at less than noisier data to, again, predict where somebody's going to end up after a stroke. So another example of that collaboration. And then our third thrust was looking at digital health. It's a very broad topic, but we're interested in digital therapeutics and digital assessment in brain health. We didn't know where the field was. So the first couple of things we've really done is set up a couple of panels sponsored by the Hariri Institute. So we had one panel, and we brought industry experts to talk about what digital diagnosis and therapeutics can tell us about the brain. That was in April. And then Hariri co-sponsored another panel discussion at a conference that we organized, which is called the Neuroscience of the Everyday World Conferences. This was neurotech. It was all companies building neurotechnology that came and talked about what they thought was happening in the fields. And then the last, again, another example, I won't have time to go over the project, but we try to use data that we've collected from a company that I helped co-found to develop a machine learning prediction. So again, another collaboration between CDS, computer science, engineering, and health. So I'll stop there.
Right, great. Thank you for being here, and Stephen, Catherine, Giannis for the invitation. So we had an FRP focused on really the intersection of climate and health, and just the premise was that there's so much data available to inform sort of the field broadly of climate and health, but it's really siloed in many of our different labs. And so, one of the first thrusts that we did was just thinking about the farification of data. So this is to make data more findable, accessible, interoperable, and reusable. And the idea was that across the BU ecosystem, there's just, terabytes or, even much more of data, and we're all downloading a lot of the same data. And so we really wanted to start by pooling some of the data together, and within the community of trust of within the BU community, say, hey, if we're all using the same satellite data or the same derived data sets, why don't we just put them in one place and share them? And so we did a lot of this legwork a little bit before the FRP, and then really moved this forward during the FRP. And in fact, some of the resources we've created here are now part of the Center for Population Health Data Sciences that Laura spoke about, and Kevin Lane is leading us on that. So that was sort of one, is sort of our joint access to data. And the second pillar was around visualizing results. Again, there's sort of this blocker. There's so much data and so much information that a lot of times, the challenge becomes, the roadblock really becomes about how do you derive insights from those data in a meaningful way. And that can be on the research side, or it can be insights that community partners or governments or NGOs that are trying to advocate for a particular solution might need. And so we looked at a couple different platforms for visualizing high dimensional data. We held a really great workshop that, again, spanned both campuses and helped people just sort of an introduction to Flourish. Flourish is really sort of out of the box, easy visualizations to make. And, in fact, we leveraged one of the data sets that we had created to look at this intersection between future increases in days of extreme heat and the percent of the population exposed to more and more days of extreme heat with their social vulnerability. So to really, can we identify those places that are heating up the fastest in terms of population exposure, so accounting for population change and accounting for social vulnerability change into the future. And that actually is a very nice paper led by one of our staff scientists currently under review. And then finally, our third pillar was really to inform policy. How do we not just keep the great research and the research results and insights in the academy, but actually help our partners in government or communities or NGOs actually be able to use the insights from this. And so Lucy Hutira, who is the co-PI of this FRP, and student, then staff working with her, became pioneered this model. We said, like, look, if we're trying to cool, reduce our urban heat islands, we have two choices. In the sample experiment, where you can either add a lot more green space, or you can paint the top of black roofs white, and that will lower the amount of heat that's absorbed and retained. And both of these things have different trade-offs in terms of the space required, the investment required, financially and otherwise. And can we identify if you constrain the total amount of money available for an intervention, what would be the optimal combination that would actually reduce population exposure by the most? And so this isn't, the available everywhere, but it came into a very nice paper for the city of Boston, and and actually Google, through Lucy's collaboration with Google, is working on a similar version of a tool where you can actually have sliders, and so they've deployed it across a number of cities in the US, where you can say, what if I change the albedo of the building characteristics in my city in this way or that way? What would be the impact of that on air temperature that people are experiencing? So these were sort of our main thrusts. We ended with a very nice symposium just in December, where we really brought together the community across both campuses that were focused on policy relevant or actionable research in this space. Had a really large audience, including from our community partners around the city of Boston. I just want to sort of step back from the research a little bit, just to highlight sort of the benefits of the collaboration. And so this was built on existing collaborations between the School of Public Health and folks in Earth and Environment and Biology and the Institute for Global Sustainability. And really, we catapulted from there with the help of the FRP to really advance in these three thrusts. And, the collaboration sort of continues. We have a research coordinating center funded by NIH to support the global community of practice in climate and health. And that type of thing is all about fostering collaboration and shared resources. We then built on that with additional NSF funding to create GeoCafe. And then separately, we have a Gateway Exposome Coordinating Center. Again, the goal of all these, the reason that, the unifying theme here is that this is all about enhancing collaboration. And so much of it starts with a program like the FRP that says, let's just actually dedicate some resources to bringing people together in novel ways to do new things that they wouldn't otherwise do. So on the last slide, lots of groups within, the BU community. The one that I lead is a BU Center for Climate and Health, based here out of the School of Public Health. And, just broadly, I wanted to put in a plug. Join us. It's a big tent, and although it's a School of Public Health center, it really includes lots of people across both campuses. Do a lot of great things, and that was the symposium that we had in December, the Climate, Biogeoscience, and Health. There's a recording online of it. It was really a terrific event. So let me pause there, and thank you.
Good afternoon, everyone, and happy Lunar New Year for people who are celebrating. So my name is Kayhan. I'm very thankful for this Hariri seed funding project. So the goal of this project, collaboration with my colleague Claire Poinson and Hiebert is to identify systematic error in breast cancer risk screening using large language models. So what do I mean by by systematic error? We want to assess whether these kind of like AI models make a mistake that is predictable. For example, they may not be performed really well for underrepresented minorities that are not trained on, or some other types of unknown structure error. So it goes without saying that AI is increasingly being used in the screening purpose. It has a lot of advantages. One of the examples is that, for example, it can enhance the detection. There has been a study in Germany, for example, that it increased detection of some of the cancer cases by 6%. It can also be used to enhance the risk of the patient, for which there is a very subtle change that cannot be detected by the radiologist. It can also improve the assessment. What do I mean by that? For the cases that are negative, it can basically assess the elevated risk of the short term of the cancer that are very useful in prioritizing follow-ups. So currently there are most common risk model for breast cancers are Gale model and IBIS model, which are epidemiological models. What do I mean by that? So basically measure the age of the participants, previous history of cancer in the family, and some other factors, and at the end, hit a linear regression to that. We know this model have some bias with respect to African American population, and but at the end of the day, it's a relatively simple model. So alternative to this model have been recently proposed is a model that is developed by MGH. Called Mirai, that looks at the mammography images and provide 1 year, 2 years, all the way to 5-year elevated risk of the cancer. But these models are trained on MGH data set, the data set we don't have access to. We know that the MGH population are quite different than the BU population. And one of the hypothesis was that while it includes the Gale model, and Gale model is biased, is there any bias in the Mirai model that use AI approach to process the mammography data? So, and bias with respect to ethnicity is just one of the examples of the bias that might be here in the data. So in fact, like all of this AI model have a lot of opportunities to encode different kinds of biases. There can be a difference between population that you train the model on. Here in this example, the population of the patient, MGH and BU are quite different. There are also difference in the individual level. For example, there might be elevated risk of the same individual in terms of performance of the AI model when the person is pregnant versus or not. So this is what we call individual level bias-inducing factors, which are unknown. And there might be, of course, biases embedded in the data. For example, the scanner that is used in one hospital can be quite different in the other one. And this acquisition induces a lot of things. And finally, there might be noise in the way that these AI models are developed. Like, for example, some of the AI architecture are more prone to learning some of the shortcut or spurious switches in the data rather than the others. So the goal is to reason about the structure of the data, structure of the mistake that the model makes using large language model. The general hypothesis of our model is that the general idea here is that identifying these risks are very, very difficult. It's very difficult for AI practitioners because they don't have the domain knowledge. It's also very difficult for clinicians because they don't know how to retrieve the data properly, how to like basically fix the risk. So the general hypothesis is that usually these kind of risks leave some traces in the data. So for example, we know in terms of population where this data comes from. Like comes from MGH is like serving this range of the patient with this background. Also, we have a lot of like information about the patient from electronic health record, for example, from the lab test at the moment of the visit, and many others that can be converted to the text. Also, metadata that comes with the acquisition are quite informative. Like, for example, if you are working with the medical images, all of the medical images follow the similar standard, and there are tons of metadata that are not really used, like, for example, the DICOM formats. And finally, there are new technologies that we have developed in our lab and also other people that can convert the internal mechanism of the AI into human understandable text. However, finding the bias in this is the same as like finding the needle in the haystack, because there are a lot of text. It's not humanly possible to look into all of this and reason about the reason for the mistake. And this is where the large language model can come in. The idea here is that we can combine all of this information and let the LLM, large language model, to reason about this with the advantage that like these LLM are specifically designed to reason and have some underlying knowledge about the domain. So the general theme here is that we combine all of this information and we use LLM to generate hypotheses about the reason for the mistake. For example, in the context of breast cancer screening, we know that many of these models have elevated risk of making mistake in a denser breast, or has some biases with respect to the age. There are other reasons for the biases that we don't know, and LLM can reason about this. So now we have a human in the loop, or in this specific case, clinician in the loop, where the hypothesis can be provided to the clinician and provided back to the LLM to provide a patch to the model. So in this case, the hard job of like looking into the data and the reasoning can be done by LLM. The human assess the hypothesis generated by LLM, and LLM can patch the model back again. So in the interest of time, I don't have time to go through the results. I'm happy to discuss some of the outputs of this project is published in Spanish, and some of those are currently, we are working on it. And if you are interested to have similar problem in other domains, for example, in the long domain that we are actively engaged, I'm happy to discuss it. Thank you very much.
Mad dash in the back of this network, because the program I'm presenting today is about the recording. Do I record, or is it
Oh, here, can you hear me now? Okay. So now more than ever, it's become clear that preventing pandemics isn't just about diagnosing a disease or creating vaccines and treatments. It's about ensuring that the data about a new threat is available quickly, is available freely, is available not just on on human diseases, but also on animal and plant diseases, because we live in a One Health world. H5N1, more than anything else, has shown us that in a tapestry where the virus is widespread across different species, we can't understand our own risk. The project that I'm about to present to you is a partnership between my center, the Center on Emerging Infectious Diseases, the Hariri Institute, and Health Map, a online program that's been around for 16 years that scrapes the web 24/7 for new news stories, as well as reports from public health organizations, chat rooms, etc. What we're presenting is a potential program that is an informal surveillance platform. And the way that it works is initially there's a signal detection. Majority of the signals would come from Health Map, who is our partner. It is available in about 12 languages, although I think this last month they've expanded to around 18, 24/7, updated every hour, as well as all the other sources you see here, and a large network of public health partners and an individual network of trusted colleagues in different parts of the world. When a message comes in or a signal comes in from Health Map, it is transmitted through a pandemic LLM that has been trained, that I'm going to talk a little bit more about in our partnership with Hariri, that looks at doing a few things. Prioritizing a signal based on preset learning and training that we've done. And that includes not just the type of pathogen or potential biological aspects of the infection, but also urgency, reliability, and potential for international spread. That pandemic LLM then translates that signal, if it's not in English, into English, copy edits, creates an initial report that includes reference data, and is sent to a globally based network of regionally based subject matter experts. So we currently have subject matter experts in about 3 continents, and at launch, which will be in April 2025, we're hoping to have it about 3 more that are both disciplinarily representative, in addition to our faculty here at Boston University, at Harvard, as well as at UC Davis, who's another partner. Our goal is to create open source data. Why do I say now more than ever? As you know, there's been public health comms blackout. Thankfully, some of the data, the FluView and others, have made it back on. It demonstrates that it is important for the global community right now, with potential outbreak of Ebola in DRC, a potential outbreak, a confirmed outbreak of Ebola in Uganda, and a lack of potential partnership between the WHO and the US agencies. It is possible that we may be missing timely information that affects our hospital preparedness, it affects our responses here. Near real-time data allows us to not just have public health and healthcare preparedness, it also allows us to educate the public about a reference with good data, about a potential event with good data. With so much mis and disinformation data, the big focus of Beacon, which is biothreats analysis, emergence analysis and communications network, is to provide context. Why does this matter now? Where could this lead? Our hope is to eventually focus on predictive intelligence that uses methodologies on not just LLM, but machine learning, as well as other statistical methodologies Laura and others have used with Epistorm that looks at spread and scope and severity of new threats. So I want to thank Yannis Pascalidis, who can't be here today, for this slide, and for his team for the work that they've done for preparing pandemic LLM. Previously, this work had been a partnership to look at a couple other use cases. One was to look through PubMed, to look for potential druggable targets on new pathogens that fall within known priority viral families if a new outbreak starts. It saves researchers time, it helps them identify potential areas where they could invest their research in. Beyond that, what we've done is look at this 5.7 billion tokens of data that we've gathered from all these different sources. In addition to this, there is a hands-on training from a network of subject matter experts that have been doing extensive work with ProMed, another informal surveillance platform, for the last 25 years. Many of those folks have left ProMed in the last year or so and continue to provide that same kind of both trust network as well as verification on the ground. And they are part of helping us design and think about how you categorize diseases when they first appear, beyond just what's in the literature. And you can see the support here that Yannis's team has received, aside from our main funding from NSF, from DOE and others as well, including NVIDIA. So here's an example of what the report may look like. I had a lot of slides, but I took them all out for methodology because I figured this is better for discussion. Just to give you a sense of what the end product is. This is a report of a Nipah virus outbreak that's happening in Kenya, in southern India. You can see that this is just the initial report created by LLM, which will then be edited by subject matter experts and then posted on our website. This is a mock-up of what the website looks like. It will go live probably at the end of March, beginning of April. And we currently have funds from Gates Foundation, as well as from NSF and a couple of private foundations. We're hoping to create an additional envelope for every event that happens, under which related resources are available that can be actionable for not just public health experts, but also for clinicians and for others in the community that are concerned about new threats. So I now have 30 seconds. I will express this by saying that what makes a program like this important is not just timeliness and accuracy in reporting that's verified, but it's also building a community around it. We currently have an international governance board that includes Jeremy Farrar, who's the chief scientist at WHO, Tom Khalil, who's a deputy director of the prior OSDP under Obama and Clinton, and others who provide technical background, like Dylan George, who's the head of CDC Center for Forecasting Analytics and Outbreak Analytics. Our goal is eventually to create a global training program that brings in our partners from the global south and creates hubs for Beacon in different parts of the world. So I hope you'll stay tuned. I think this will be a resource for our BU community for research, and we will have a launch event on April 24th. Thank you.
All righty, that was the last of our lightning talks. Thank you, Nahid. We're a little over on our program today, so I just want to make sure that folks got to see this slide again. For people who are interested in applying for the Hariri FRP program, most of the research you saw today was funded in some part by that. The pre-proposals are due on February 14th. I very much encourage you to have a conversation with Yana Spashlides if you are interested in submitting a pre-proposal. The instructions for how to do so are on the table toppers in front of you and also on our website. Before we move on to the next section, does anybody have any questions about the seed funding program? It's usually 2 or 3, looking for other faculty members who could participate on the project. So it's not just one effort towards a single goal, multiple efforts as well. So looking for interdisciplinary projects that could bring people together. Anyone else? Before lunch, I also want to take the opportunity to thank our speakers who came today, took the time out of their day to speak with us, and the staff members who also made this event possible, specifically Catherine and Robin, who's sitting in the back of the room. So please give them a round of applause. I'd like to thank you all for coming. Feel free to dig into lunch.